Hi, I'm Sharon Gilmartin, Deputy Director of the Safe States Alliance. In this module of the Safe States Injury and Violence Prevention 360 self-study, we will be focusing on the foundational elements and terminology of injury and violence prevention. First, injury and violence prevention is grounded in the public health approach. Perhaps the best definition for public health is that it's what we do collectively as a community or society that assures the conditions in which people can be safe and healthy. Public health is not what we do to or for people, but rather what we do with people. When we talk about public health, we're also talking about ways that we can improve health and well-being for people across the community, not just one individual at a time. Many of you may have also heard the term population health, which is a term that healthcare professionals are using. Fueled by rising healthcare costs, the Institute for Healthcare Improvement developed a framework called Triple AIM to optimize health system performance. The framework was developed to simultaneously pursue three dimensions, which include improving the patient experience of care, which is where quality and satisfaction come in, reducing the per capita cost of healthcare, and then improving the health of populations. The addition of this third aim indicates that healthcare leaders are increasingly recognizing that social and environmental factors outside the healthcare system have a significant impact on health. However, hospital systems may still be more likely to focus on individual patient outcomes and lessening costs associated with care. So in this module, we will use the term public health. The public health approach is a four-step scientific systematic process that includes 1, carefully describing the problem through data collection and surveillance, 2, studying factors that increase or decrease risk for injury, 3, designing, implementing, and evaluating intervention strategies aimed at decreasing these risk factors and increasing the protective factors, and 4, taking steps to ensure that proven strategies are widely disseminated and implemented in communities nationwide. So the first step in the public health approach is the ongoing systematic collection and analysis of injury and violence data. Public health professionals often refer to the data collection process as surveillance. It's important to note that the use of the word surveillance means something different to public safety officials than it might to the general public. Injury and violence prevention professionals must communicate clearly when speaking with partners and stakeholders who may use different terminology. And don't be afraid to check in with partners to make sure everyone's on the same page throughout discussions. In addition to public health surveillance data, there are numerous other sources of state and local data, including trauma registries and hospital discharge data. These data sources will be discussed in greater detail in another module. Data can provide information about how an injury problem changes over time and alert professionals to troubling trends in a particular type of injury. Data is also critical to evaluating the impact that prevention programs are having. There needs to be continued improvement of systems to ensure the quality and timeliness of data. The interpretation of data is also important so that it doesn't inadvertently perpetuate myths or misrepresent facts. The second step in the public health approach involves identifying the root causes and risk factors for injury and violence. Risk factors increase the probability of experiencing a poor outcome. Examples of risk factors include unemployment, poverty, or lack of access to safe transportation. Protective factors are things that can decrease the likelihood of experiencing an injury or violence and mitigate an adverse outcome. Examples of protective factors include safe physical environments, equitable educational opportunities, economic stability, connectedness, destigmatization of help-seeking behavior, or access to services. You might also hear reference to shared risk and protective factors. These are risk and protective factors that are common to more than one injury outcome. So by addressing the shared risk or protective factor, you have the opportunity to address multiple injury or violence outcomes simultaneously. I put the URL up here. You can check out the Safe States Connections Lab on our website for more information on shared risk and protective factors. Once the information about risk and protective factors has been identified, strategies can then be developed and implemented to eliminate or reduce risk factors for injuries and to capitalize on or increase factors that protect people from being injured. So in the third step of the public health approach, We use the knowledge that we have learned through steps 1 and 2 and develop, implement, and evaluate prevention strategies in communities that are experiencing the problem. The evaluation information is used to identify any components that need to change to eliminate difficulties or increase effectiveness. There are many scientifically evaluated, evidence-based interventions that have proven effective in reducing injuries and violence. A great place to start is the Injury Prevention Inventory on the Safe States website. I put the URL here. This online hub connects you to a variety of prevention strategies, each with their own sample distal, which means direct, or proximal, indirect measures, and related resources across 17 different injury and violence topic areas. The fourth step in the public health approach is to ensure that the strategies shown to be effective in the third step are adopted and disseminated broadly. Injury and violence prevention professionals are encouraged to implement strategies based on the best available evidence and to continuously assess whether the strategy is a good fit within the community context. While there are numerous effective strategies, the dissemination of evidence-based strategies from research to the practice setting has encountered numerous barriers and has been a continuing challenge. Lack of awareness among practitioners of evidence-based interventions, limited funds, resources, and infrastructure to support implementation and sustainability of complex and costly interventions, and lack of political and social will have presented obstacles to dissemination and adoption of effective interventions. As will be discussed in further detail in other modules, injury and violence prevention practice is layered with diverse and complex community and social circumstances. These policy and social factors were accentuated during the COVID-19 pandemic, which exacerbated health, economic, and racial disparities in the US. Injury and violence prevention professionals should be committed to continuous examination and reflection of science, policies, and public health practices through a lens of racial and social justice. Now, let's talk about a few more terms you'll likely encounter in your public health work. Many of you have heard a version of the following public health parable. A woman was walking along a river when she noticed someone drowning as they floated downstream. The woman swam out to the person, pulled them to safety, and successfully resuscitated them. Soon, another drowning person floated down the river. Again, the woman swam out, pulled the drowning person out of the river, and successfully resuscitated them. Before long, more and more drowning people began to float downstream. While others jumped in to help the woman rescue the drowning people, it was impossible to save everybody. Exhausted, the first woman started walking upstream. The others called to her to come back and help. "Why are you leaving?" they asked. "We need your help." "I'm going upstream to find out why so many people are falling into the river," she replied. When she arrived upstream, she discovered a broken bridge was causing people to fall into the river. She enlisted the help of partners to fix the bridge to prevent people from falling into the river, instead of trying to save them one by one after they were drowning. The aim of the public health approach in the realm of injury and violence prevention is to keep individuals from being injured in the first place, aka fixing the bridge. We refer to this as upstream or primary prevention. Often that means working with all partners and stakeholders within a system to implement strategies and policies that ensure the environmental conditions that allow everyone to be safe. Public health works with partners and community members to fix or build the bridge. Upstream public health prevention also involves reducing disparities that contribute to injuries and violence and increasing those factors that protect individuals. In addition to primary prevention, there are also secondary prevention strategies. Secondary prevention, which typically occurs midstream, in other words, while the injury is occurring. For injury and violence prevention, this could include interventions like airbags that lessen the severity of a crash while it's occurring, or screening programs among persons at risk for certain injuries and violence. It could also include managing conditions and related complications so their progress is slowed or stopped. In the river parable, secondary prevention is pulling the individuals out of the river as soon as possible so they don't have long-term conditions. Another example would be screening, brief intervention, and referral to treatment, also called SBIRT, which is an approach to identify persons at risk of alcohol or drug abuse and referral to get them into treatment. And then finally, there's tertiary or downstream prevention. This includes the measures taken to reduce further complications of an injury. In the river parable, providing immediate resuscitation to the individuals and rehabilitation, if needed, is an example of tertiary prevention. While all activities across the prevention spectrum are valuable, to achieve a safe, healthy population and productive economy, it is critical to invest in primary prevention to stop injuries and violence before they occur, instead of just minimizing the consequences. Primary prevention is the most effective strategy to improve the safety and health of a community, resulting in the highest savings relative to its cost. Communities benefit when all systems work together and align efforts.